Welcome to Prepare Tennessee LTC, a podcast created to provide resources and information on the current topics experienced within Tennessee long-term care and skilled nursing communities. I'm your host, Rachel Turner, an Associate Program Manager here at Vanderbilt University Medical Center's Program in Disaster Research and Training. Today, I'm here with Greg Edwards, a Vulnerable Population Coordinator with the Tennessee Department of Health, to discuss the Tennessee HRTS program. You are currently listening to part 1 of this series.
Thanks for having me on the podcast. My name is Greg Edwards, and I'm a Vulnerable Population Coordinator with the Tennessee Department of Health. I'm working with the Knox East Tennessee Healthcare Coalition, and we're right now rolling out this healthcare resource tracking system across the state to all of our long-term care skilled nursing facilities. And this represents a really exciting opportunity for those facilities to become part of this expanding network through the Healthcare Resource Tracking System, which we affectionately call HRTS. Just to give you a little bit of background on what HRTS is, it is part of the Emergency Preparedness Program. It is developed and maintained in-house by the Tennessee Department of Health, and it's intended to be both an emergency response management system but then also a resource tracking tool for our healthcare facilities. And it helps to coordinate all of these efforts happening across the state so that stakeholders from Governor Lee and his mayor co-op to the local coalitions for healthcare providers, and honestly right down to the individual facilities, can remain better connected and better able to respond in the event of an emergency, such as this ongoing COVID-19 crisis. But the tool was not created specifically for COVID. It has actually been around since 2007 and has undergone a couple of different revisions since then. The tool as it exists right now is a web-based application that runs in any web browser, so it works equally well on your PC, your Mac, or to some degree even on your mobile device. I would say we don't have a mobile app ready quite yet, but the system does work well enough on a mobile device that you can use it. And this tool allows us to securely connect with the network and to communicate with one another in the event of one of these emergencies that we need to respond to. And so I'll take you through just kind of a top-level tour of what the tool looks like and talk to you about some of its features. I'm going to switch over to my browser, and what you're looking at here is the login page for the HRTS system. And so as you can see here, it's very simple and easy to use. It indicates that this is a tool from the Tennessee Department of Health, and it provides a secure log-on portal for users. And I want to make it clear that this data is maintained securely. Everything is encrypted, and this information is not shared with anyone outside of the HRTS system. So each user would have his or her own login, username, and password, and we try to make this system very self-serve. So within each facility, we set up at least one user as an administrator for his or her facility. Then that administrator can manage the users there and can do a lot of the maintenance work. We never wanted to create a system where the users felt like they had to call somebody in Nashville just to make a simple change or to use the tool. Now, that's not to say that we don't have a lot of technical support available. We actually do have a dedicated support desk staff for this product and a dedicated email. So if you happen to need your password or your user ID, you can get those things emailed to you. I've already put my user ID and password in there, so I'm going to go ahead and click login. Now, I'll mention just within the podcast here that we're going to see some things that the typical users wouldn't see when they're logging into the system. The information that you see on the screen really depends on what kind of user you are and how much information you have access to. So what I'm seeing right here is a dashboard for the entire state showing all the facilities that we have tracked in the system. And I can really zero in on a particular area that I want to work with. But most users are going to see just their individual facility. And so as I scroll through this list here, you see that we serve not just emergency acute care facilities and emergency departments, but also now behavioral health, long-term care for skilled nursing, and so on. So if I were to just drill into one of our facilities so that you can see what this looks like, we get a page for each individual facility, and that really gives us a snapshot of what's going on at the facility. So we can see the overall status of the facility. which means, is everything working as normal? Do we have an advisory situation where we're monitoring an ongoing or developing emergency, or do we have a critical emergency that's impacting patient care? And this is something that the individual administrator at the facility can manage. As a resource tracking tool, though, this page allows us to see at a glance how many beds are available at the facility, what services are offered by the facility, and also, very importantly, what resources are available there at the facility for the healthcare providers. And so by tracking this information, we can drive a lot of dashboards, we can drive a lot of interactive reports, and we can help to coordinate those facilities as they're responding to emergency events. A big part of this tool is going to be improved communication. And so by creating a network between the facilities, we're able to quickly get in touch with anyone who uses the system. Now, that could be a hospital trying to contact a long-term care facility for patient transfer or placement. And rather than relying on looking up the information on a public search engine and trying to figure out who's the right person to talk to for admissions, or how do we get in touch with the director of nursing, we give the facilities the opportunity to put all that information into HRTS. And once it's in there, it becomes very easy for other facilities to search and to get in touch with them. In fact, this system does allow us to track all kinds of information, from licenses and certifications to website addresses and even geolocation. So we can pinpoint a map, we'll know exactly where a facility is. And that drives not only better communication, but it also helps to determine what facilities might be impacted by a geographic event. And so at the bottom of each page, we also keep track of exactly who administers this facility. And so this also becomes kind of a contact directory for the facilities. As an administrator of a facility, this allows me to easily manage all the people who are working under me. And so in addition to allowing us to track information about each facility, we've also got this very rich event management system. And so I can come up here to the event tab near the top of the page, and I can create if I'm a properly authorized user, or I can view events that might be open in the system. And so the way that I would explain this feature is that it's kind of like the emergency alert system that you routinely see on television. So this would give us the ability to quickly broadcast an emergency communication out to all the facilities that are affected by geographic region or by service line. And so I don't think we have any that are active at the moment, but we could go in here and look at the types of events that maybe have been created in the past. A lot of these are, of course, going to be drills, but I could select an individual event so that you can get an idea of what that event looks like.
A question, Greg. Would a facility be able to send out one of these messages only to the people in the facility themselves? So say there's an active shooter, would they be able to send an alert through HRTS to just channel that facility?
That's a great question, Rachel. Yes, the system does allow for individual facility users to broadcast a status change or to say that we have an active situation. And the way the system is structured, everybody at the facility would be notified either through an SMS message on their phone or through an email. The kinds of events we're looking at here tend to be a larger scale and require more coordination. So these are limited to only regional coordinators or state officials. But once the event is created, then anybody who's impacted can participate in the event. So the most recent event that HRTS users would probably recognize, because it's been going on for some time, is the statewide COVID-19 outbreak. So if I click on that event, the page will load, and you can see here that the COVID outbreak event page is kind of a news portal for everything that's happening in terms of communication between the facilities across the state. So we can see exactly when it was raised, who raised it, what types of facilities are affected, and then a general description. But the really interesting stuff happens in the middle of the page here, where we have an ongoing dynamic chat happening between the different facilities and personnel. So someone at the state could ask for information, and then each of the individuals participating in the event can easily reply over here. And it's a rich environment, so I can actually upload pictures, videos, and other types of files. We get some additional information here about exactly what facilities and areas are impacted. And then we can also see logins so we know who's participating in the event. Like I said, it just tends to be a really great way to keep everybody working together by providing a central place for news and updates. The other big benefit of this system is that it drives some really interactive dashboards. Now, these dashboards are publicly available data, so a lot of the information that we see there is aggregated between the different facilities, but it's used mostly by facilities who are attempting to make better informed decisions in response to these crises. So to give you an example that's COVID related, we have a state regional hospital resource use and availability dashboard. And all of these are available from within the HRTS application. So you can see this gives us a very visually oriented look at the availability of different types of resources. And these numbers that you're seeing on this dashboard are all driven from data that comes out of the HRTS system. So if I'm looking for ICU beds, for example, we can see that out of the over 2,000 ICU beds that we have in the system across the state, we may only have 300 or so available. So we can really pinpoint where we're starting to run into critical shortfalls of resources easily within the state. And of course, at the bottom of this page, you're going to see common PPE, and that's something else that we encourage the facilities to track. Now, as I mentioned, all of this is interactive. So if I wanted to drill down just to the East Tennessee region, then I can do that very easily, and I can see how our region compares to other parts of the state. In fact, I can go here and I can just look at Knox County, which is my hometown area. I can see how we're comparing to the rest of the state. And so again, all of this data is being generated through the HRTS system by the facility's self-reporting, and it's allowing all of our stakeholders at a state level to have access to that data and to make better informed decisions. Now, one of the things that we recognize right now is that the facilities are really being tasked with doing a lot of reporting. They're being asked to report numbers often multiple times per week by a number of state and federal agencies. And we're very aware of that. And we don't want to tax the personnel by asking them to enter even more information. But I think a really key message here is that long-term, we'd really like to become the one-stop shop for this type of reporting that all the facilities are doing. And to give you some idea of where we're going with this, we'd really like to be able to replace a lot of that federal level reporting that the facilities are being asked to do, so that data would come to us at the state health department where it can really do the most good. And then we can consolidate data for the entire state, and we can send that on their behalf to the federal agencies that need it. The situation that we're in right now is that we really have to get all the facilities on board with doing this reporting and prove that we can provide that data at a federal level before they'll allow, the state to take that on. They've already done this at the acute care facilities. And they're having massive success with it. And so now we're hoping to roll that out to our smaller facilities, starting with our skilled nursing long-term care.
I have a quick question again. Right now with the resources, the example shows the statewide hospital resources. Will the facilities, the long-term care and skilled nursing facilities be included in this number, or will they have their own category?
That's a great question, and they're constantly developing additional dashboards. You can see that some of the additional dashboards are available on that page as well as here. So if I wanted to look at something that is more specific to our long-term care, here's one that was created just for LTCs. So this dashboard shows a map of the entire region. Similarly, it allows me to drill down to just specific parts of the state or to look at specific services. One of the reasons that we ask the facilities to track their individual services is so that as an acute care facility, perhaps who's looking to transfer a patient, I can come in here and say, okay, I need a skilled nursing facility that offers a skilled bed and also services such as stroke rehab. And so once we're able to really zero in on what it is we're looking for and what region we're looking in, then it becomes really easy for that facility to perhaps target an individual long-term care skilled nursing facility. And as you can see here, it really simplifies things by even giving them direct access to their admissions number. So what we're aiming to do is really to take a lot of the guesswork away and the investigative work that takes additional time and effort, and just make it a really simple and easy way for facilities to stay in touch with one another.
When a facility logs all of their information each day or each week, it automatically updates all of these extensions or these dashboards, or do they have to do anything separately to be put on the long-term care portal that you're showing us now?
Great question. That's all handled automatically behind the scenes. So these dashboards are built to pull in data, to ingest data automatically from HRTS. All the facility staff has to do on a weekly basis is to log into HRTS, into their specific facility page, and locate metrics for their available beds, for their services provided, and for their resources on hand. And we make it really easy to update that information. So for example, here I have all of these resources already set up. That's something that we do when we work with the facility initially, is we partner with them to make sure that their profile is set up correctly, that all of their inventory is set up the way they want. And then the individual frontline worker or office administrator just has to come in here once per week, click an update button, fill in, as you can see here, almost a small spreadsheet with some specific numbers, and then save, and they're on their way. The entire process for the individual facilities should take less than 5 minutes once they're familiar with the system, how to get in, and how to update their information. And the nice thing about this tool, I'll mention, Rachel, is that because it's being developed and maintained in-house, we get questions all the time from our users asking for new features, maybe new types of resources to be added to these lists, or just changes in general that better accommodate the way their facility operates. And because this is a tool that's developed and maintained in-house, it's something that we're actually able to do, I would say, fairly easily. We like to weigh the cost-benefit analysis of every change that we make to this system, but we have developers on staff who are constantly making these types of changes. I'll tell you, for example, that new features have been rolled out just in the last couple of weeks to handle surge sites, or to handle improved bed tracking, and just to capture the metrics differently. So this is a tool that is undergoing constant improvement, constant change, and I think they're looking to bring even more features to it in the near future. The other thing I guess I could show is that there is a lot of information in the system itself. So we want this to be a self-serve. We want it to be easy for new users to come on board and to understand how to use. So the system features a complete help resource menu. And if I go into the user materials, all of the manuals that the user would need from an end user, someone who just logs in to update counts, all the way up really to a system administrator, all of that information is made available right here on the helps page, as well as a series of informative tutorial videos. So these videos are very short and targeted. They're usually 5 to 7 minutes, and they show users how to do very specific things. I need to add a new bed type, or I need to access a dashboard, and they can be tailored for users of a specific service line or type of facility. So for example, in here we have some videos just for our long-term care. We have some videos just showing event management, and then more general videos up here at the top.
So say a facility wants to schedule something more one-on-one with a tutorial on how to work the site and set up their facility. With COVID and social distancing, does the program allow for something like that, or do they need to more utilize the help tab on the website itself?
Absolutely. We work with individual facilities to get them onboarded any way they prefer. What's worked really well for me, supporting the East Tennessee region, I've got 54 different facilities that I've been working with to get them on board over the last few weeks. And we found that the same technology that we're using today to record this podcast works very, very well for this type of training. Generally, I would want to have a brief phone conversation with the administrative staff just to better understand their concerns or questions and to get an idea of how they intend to use the tool. But then when we schedule the training, it's usually very short, 90-minute training session at the most for the administrators. In some cases, the facility will want to have their whole staff come in, maybe over a lunch break, or we can do shift-based training sessions. But we would just use a tool like WebEx or Zoom, and we would connect virtually. We have a full training environment where I can create user accounts that we can use during the training session. And during that training session, I would just take the entire staff through the system very much like I've done today, a little more detailed, and I've talked to them specifically about what the numbers impact and how they should be entered and when and that sort of thing. But I also go through, user administration for the facility administrators. I can show them how to set up a new user account, what kind of information we need to track for each user, and how users do things such as update their passwords or change their contact information. So like I said, all of that takes generally 90 minutes or less per facility. Some prefer to have one person trained, maybe a director of nursing, and that person then becomes the trainer. And so as new people come on board, they just give them a very, high-level HRTS overview. And one of the neat things that we're seeing happening with this system as it's deploying across the state is when we have users who maybe move from one facility to another, they come on board at a new long-term care, for example, and the HRTS training not only can be part of their new employee onboarding training, but they can also leverage any experience they've already got with the HRTS system. So if they're already in the system from a previous facility where they work, well, then all we have to do is just move them to the new facility in the system so they have access to what they need and they're ready to hit the ground running. So by creating this statewide resource that's consistent, that's always going to work the same from one facility to another facility, we really are improving efficiency and the ability for facilities, I guess, to onboard new staff more quickly and consistently.
Thank you, Greg, and thank you to our listeners for joining us today. This concludes part 1 of our podcast with Greg Edwards. If you have questions regarding anything that was mentioned in today's podcast or would like to learn more, please visit our website at www.emergencyltc.org.